Hi students, this is the first Unit 4 lecture video. Our goal will be to review the information and point you towards some test questions and some follow-up study areas for you as well. This is a very dense unit, as you can see. There's lots of information here. Keep in mind that your e-text does have review questions if you access the e-text from the modules. So scroll on down through the modules past the work that's due, and accessing the e-text that way gives you a few extra bells and whistles. So we're going to talk about vitamins today, water-soluble and fat-soluble. And that difference is very important. It tells you a few important things about the vitamins. The water-soluble vitamins, okay, typically don't become toxic as easily. Okay, we'll see that there are ULs for water-soluble vitamins, but some of them don't have a UL. And the reason for that is because we don't have a limit to the amount that is safe. So you'll look at B12 and see that there is no UL. From what we know, B12 does not reach an unsafe level. But some of the others do have UL values. So it's more difficult to reach a toxic level because they tend not to be stored in the body. But for that same reason, you need to have water-soluble vitamins in your diet more consistently since you don't store them. Now, the fat-soluble vitamins are stored, and you'll notice the margin of safety from your goal to your UL is a little bit more narrow. For both types of vitamins, it's difficult to reach the UL without taking supplements from food only, especially from food that's not fortified. So the fat-soluble vitamins are stored, and because they're stored, they become more toxic a little bit easier, and also you don't have to have them as frequently. If you have a lot of vitamin D one day, you pull from your stores through the rest of the week perhaps. Now, to find these vitamins in your food, you need the variety of foods, and that's what these charts always show us. There are some crossover. One of the questions I'm always asked is, I don't like vegetables, but will fruits provide the same nutrients? For some, and you can see that here, vitamin C, folate, vitamin A, but vegetables really are packed with more vitamins than fruits. So it's a bit of a substitution, but not perfect. Now, I mentioned fortified foods. Could there be an issue with going overboard with fortified foods? And the answer to that is yes, it's possible. If you or a child perhaps eats a lot of fortified breakfast cereal and vitamin waters and snack bars, it's possible to go above the UL. And that's what we see here. Percentage of children consuming more than the UL. For zinc, it really is significant. We'll talk about other concerns about fortification when we look at folate. Absorption of vitamins differs depending upon whether they're water-soluble, very easily absorbed, or fat-soluble, absorbed with the fats and travel with the fats in the body. So we'll start here. And as I mentioned, this unit has a lot of little factoids. I think it's a great unit to do a couple of things. One is to make flashcards. I'll try to point out the most important facts, but the other is to try to make connections, make these vitamins important, read about them, look at your eye profile, do your homework, and think about them. The more connections you make, the easier it will be to remember. So these are the B vitamins and vitamin C. These B vitamins are coenzymes, so they combine with an enzyme to make it active. They are essential to the action of that enzyme. We see coenzymes as being essential in the energy yielding pathways, and that's what you're looking at here. So when people say, when I don't get enough vitamins, I feel tired, it's not because vitamins give you calories or fuel. They don't. But as you can see, and it's a little bit difficult to see, all these little rectangles with vitamins inside, Those are places that vitamins act as coenzymes. So without sufficient vitamins, you can have a very inefficient process of generating fuel, and that could make you tired. Let's start with thiamine. Now, when you see a link, my suggestion to you is after we cover these slides for you to go into the slides on your own and access all the links by left clicking. So be sure to do that. And again, I'm going to point you toward what may be test questions or is very important. So when we look at these vitamins, we're concerned about their roles, their sources, what may be problems as far as deficiencies, and especially deficiency diseases and excesses, and some other little important facts. So whenever you see a deficiency disease, such as beriberi and Wernicke-Korsakoff, you need to read about that and remember that. Thiamine's important in energy production. We'll use the name, not the number, unless this slide is titled with a number. So I won't trick you with that. In test questions, you'll see thiamine. So beriberi and Wernicke-Korsakoff are deficiency syndromes for thiamine. Very, very serious. These are deadly deficiency syndromes. One of the things you'll see as a common thread is that with B vitamins, deficiencies tend to affect the skin, the GI tract, and the nervous system. So look for that when you look at the symptoms of the deficiency. Read about the deficiency and how it was discovered, and every time you see a little case study file, I'd ask you to click into that. These are clinical case studies for the most part, and they're very interesting. In class, we'd go over them together. I don't want to make this longer than it needs to be, but I expect you to click into these and read them. Next B vitamin is riboflavin. I always remember riboflavin as green and white, a lot of green vegetables. Also, we see it as important. Milk is an important source of riboflavin. A little extra tidbit about riboflavin is that it's easily destroyed by heat and exposure to light. That is the main reason that most milk is packaged in cardboard or opaque cartons to protect the riboflavin. Again, click into this to read about riboflavin and migraines. There's not a named deficiency besides ariboflavinosis, but this is what you see with riboflavin deficiency. You see a swollen tongue and cracking of the lips and the corners of the mouth. So remember, skin and GI tract. Look into the case study and read about this. It will connect this in your brain so that you remember it on the test. Niacin is an interesting B vitamin because it is unique in that you can make niacin from an amino acid named tryptophan. So you see that here. You can get niacin from food, or if you have enough protein in your diet, you can use this amino acid as well to make niacin. That helps me also remember that several protein foods are good sources of niacin as well. Pellagra, click into this and hear about pellagra. It's very interesting because we had a history of pellagra in this country, early 1900s down south, in a lot of impoverished individuals on very limited diets. I really recommend that you listen to this video. Remember pellagra as the 3 or 4 Ds: dermatitis, the skin; diarrhea, the GI tract; dementia, the nervous system. So there you see that thread. And of course, it's deadly. And check into the case study as well. Now, we talked about problems with fortification, but this was the public health impact of fortification excuse me, with regards to pellagra. So you see here that after we started adding back in niacin into our grain products, there was a steep drop in the number of deaths from pellagra. Couple of other things about niacin here. Niacin is interesting in that overuse can cause some problems, and some of these are really significant problems. In fact, the history of niacin supplementation is that before we had cholesterol-lowering prescription medications, as we do now, niacin was used to treat high cholesterol with some good effect. But we also saw that it caused capillary dilation or flushing, intense flushing, and you can see that here. And it caused some impairment of liver function as well. So it didn't come at these very, very high levels, and that's important. This is not the amount that you'd get from a regular diet. These were high levels of niacin. It did come with some unfortunate effects as well. Two other B vitamins. I would say that we don't talk a lot about pantothenic acid because it's widespread in food and we don't see a deficiency commonly. Biotin's kind of interesting though, because biotin deficiency relates to its source and the handling of its source. So here's the deal. Eggs are a good source of biotin, but eggs also contain a protein avidin that binds biotin and makes it unavailable until that protein is cooked and denatured. So people that consume raw eggs run the risk of a biotin deficiency. Read about that here in the case study. Vitamin B6 has a number of important roles in the body, number of food sources as well. The deficiency again affects the nerves and the skin. Not the best picture, but you do see a dermatitis as well as anemia and convulsions with vitamin B6. One thing I neglected to tell you is that vitamin B6 may result in impaired hemoglobin synthesis. B6 has an interesting history as well because it taught us something about B vitamins several decades ago. When I was in school, we believed that water-soluble vitamins, which include B, all the Bs and vitamin C, could never be toxic because the excess would be filtered out by the kidneys, lost in your urine. There were researchers doing studies on vitamin B6 and its effects on premenstrual syndrome. And what they found was that vitamin B6, did help lessen the effects of premenstrual syndrome. So after that, those results became widely known, women started running out to stores and buying a lot and taking a lot. And some of these women ended up with permanent nerve damage, permanent numbness of their fingers and toes. We learned that although vitamin B6 is water soluble, it is stored in muscle tissue. And really, there are a number of possible uses of vitamin B6. It's shown to be effective in decreasing nausea in pregnant women, but we need to make sure that women who take it don't go overboard. The UL is very important for that reason. I mentioned folate a while back and its implications with regard to fortification. So let's get there. The natural form of folate is folate. The fortification form is folic acid. You can see here it's important for DNA synthesis. A low folate intake in pregnancy is associated with neural tube defects. And we also know a low folate intake is associated with heart disease risk. And this is related to homocysteine, and folate being one vitamin that breaks down homocysteine. We talked about homocysteine in Unit 2 with regards to heart disease. It's an amino acid that damages blood vessel walls. So folate is fortified or grains are fortified with folic acid. You see that here. And there are a lot of natural sources of folate as well. Lots of greens and citrus, good sources. Now, a couple of things that we need to understand: the relationship between folate and homocysteine. By the way, B12 and B6 also break down homocysteine, so they're all good for lowering the risk of heart disease through this pathway. Folate deficiency causes an anemia, but it's a large cell or macrocytic anemia. So you see that here. With a folate deficiency, cells can't divide, they stay big and lazy. Macrocytes. Deficiency increases a pregnant woman's risk of having a baby with neural tube defects, very serious birth defects, and that's the reason that grains were fortified with folic acid. So we'll get to that fortification link in just 1 minute. Let's jump to vitamin B12. Vitamin B12 is important for iron absorption. It's not found in plant foods, so vegans need to supplement or consume a fortified food. And there are a couple of people who are at risk for vitamin B12 deficiencies, so I always use this next chart to explain why. All right, if you follow this carefully and read through each of these steps, there are a couple of ways that vitamin B12 must be handled in order to be absorbed. So let's talk about that. When you consume vitamin B12 as part of food, it's bound to protein. In the stomach, your stomach acid releases B12 from food proteins. So individuals without enough stomach acid, atrophic gastritis, may not be able to absorb the B12 from food. That's relatively common in older people. But this is also an issue in individuals who take antacids, especially the stronger, longer acting antacids, the proton pump inhibitors. So, without enough acid, you can't absorb B12. You can remedy that with a vitamin supplement because B12 is not bound to protein in the vitamin supplement. The next step requires intrinsic factor. Intrinsic factor is a glycoprotein that's made in the stomach and binds to vitamin B12 and allows it to be absorbed. Some people stop making B12 either because of a stomach injury or just an unknown reason. Those individuals have what's called pernicious anemia. Even B12 supplements will not help this individual because they do not have intrinsic factor, which is necessary for absorption. So people with pernicious anemia need to get injections of B12. I did want to mention one more thing about B12 injections. B12 doesn't have a UL. It's very safe. It also, after you have an injection, gives you a burst of energy. So doctors sometimes use B12 as a placebo, pat on the back, send you on your way type addition to their treatment plan. Whether you think that's ethical or not ethical is up to you, but it is safe. It's relatively cheap. But unless you have a deficiency of intrinsic factor, you do not need B12 injections. All right, so back to fortification and that link. What we know is that B12 actually activates folate. Okay, so without enough B12, what would happen first is that you would develop a folate deficiency anemia, and hopefully that would get you to the doctor. However, if a lot of folic acid is coming in from supplements, the concern is you don't need B12 then to activate that folate, and therefore you might miss that first sign of a B12 deficiency. Now, after many, many months and maybe even years of not having B12, you can develop permanent and rather severe nervous system impact of this. things that look like a brain tumor, numbness, falling, forgetting. One other connection to older folks, we said that B12 was difficult to absorb without enough stomach acid, and older folks were prone to that. Well, guess what? B12 deficiency also looks like cognitive decline. So it should always be ruled out first in an older individual who is having problems remembering, coordinating, etc. And then very, very lastly, let me see if I can find the correct slide for this. I'm not sure if, let's go back here. One of the worrisome things about supplementing or fortifying grain foods with folic acid, the upside was, after this happened, the number of babies born with neural tube defects declined significantly. It was a public health success. But we also noticed that there was an increase in cancer. And the fear is that since folic acid is important for DNA synthesis and cell replication, cell division, then this could actually hasten the growth of cancers. So there's a little bit of concern in some communities that fortification is good for some things, but may cause some issues in other areas. Okay, we're getting there. Our last water-soluble vitamin is vitamin C. This is the first of the antioxidant vitamins we'll talk about. It's important for a strong immune system. So you need to make sure you attend to this. And it's very important for healing because it produces collagen. So here you see collagen production. Patients in the hospital who are healing get extra vitamin C, well above the normal RDA. And here you see how an antioxidant protects you from free radical damage or oxidative damage. So the vitamin C deficiency disease is scurvy. Early signs relate to that breakdown of collagen. So you'll see little pinpoint hemorrhages in the skin, and you'll also see bleeding gums. If this isn't corrected, it can cause death, and you see here. Definitely read this little case study out of Massachusetts. It's not so hard to get the vitamin C you need, but if you're not eating fruits and vegetables, you may not be getting enough. All right. Now, the good news about the fat-soluble vitamins is there are only 4, so we're almost finished here today. A, D, E, and K. We talked about why being fat-soluble is important, what that tells us already. So let's start with vitamin A and what's kind of key about it. Your body can make vitamin A from a precursor, okay? Carotenoids, and those are found in plant foods. So you can get your vitamin A from these brightly colored plant foods or already in vitamin A form from animal foods. Very important for night vision, cell differentiation, and growth regulation. So the early sign of vitamin A deficiency is night blindness. Read the case study here. It's about a gentleman with night blindness. This slide illustrates why night blindness is caused by inadequate vitamin A, and you can see here that vitamin A is important in this visual process. The other symptom we see with a vitamin A deficiency is a change in nature of tissues. So there's a problem with gene expression. You'll see something called keratinization, where linings that should be nice and moist and mucus secreting are keratinized, are hardened. We see this with the outer layer of the eye here as well. This is not a cataract. This is a permanent blindness called xerophthalmia. You can also see little plugs of keratin in the hair follicles, which look like goosebumps, by the way. So you can find vitamin A in a number of animal foods that are listed here. Most Americans get about half of their vitamin A from animal foods. Liver and fish, not fish oil supplements, fatty fishes. That's kind of badly written there. Liver and fatty fishes have a lot of vitamin A, and this is probably one of the places where there are cases of individuals who eat these foods twice a day, every day, and develop a toxicity of vitamin A. Beta-Carotene found, it's very bright orange. So you find it in bright orange and deep green vegetables because the chlorophyll and the bright orange make a deep dark green. Vitamin A toxicity actually can cause some serious problems. Vitamin A toxicity, yes, that's what I said. Keratin toxicity is not dangerous health-wise, but this is what happens. That pigment is stored under your skin and it can tint you a little bit. I've never seen a hand like this, although I eat a lot of carrots and there are sometimes I think the palms of my hands look a little bit yellowish. Someone may notice this if their young children eats a whole lot of vitamin A rich fruits or vegetables. And again, this is not dangerous because there's a limit to how much vitamin A can be pulled or how much keratin can be pulled out of your fat under the skin. And to reverse it, you would simply cut back on the foods. All right, moving along. Vitamin D is what is sometimes called the sunshine vitamin because our bodies can make it if we get enough sunlight exposure under all the right conditions. It is toxic at high levels, but those levels are pretty high and pretty hard to reach unless you're taking very high doses of supplements. The deficiency in children is called rickets. Vitamin D is required for calcium to be absorbed, so without enough, what happens is the baby's bones are soft and bend. There you see how sunlight begins a process of making vitamin D. The issue around sunlight, however, and this is how vitamin D is involved with calcium absorption. Review these slides. Okay, and there you see rickets and osteomalacia. Review these slides as well. So here's the issue about vitamin D. I challenge each of you to check your eye profile and see what percent of the DRI you consume, because a lot of you will be close to zero. There are animal products that do provide vitamin D, but the amounts are relatively low. And a lot of us don't get the sunshine we need because of things like school and work and smog and being far away from the equator, or being the wintertime, or wearing clothing, or having darker skin. There are so many different things, or being older, which decreases your production from sunlight. So there are a lot of things that get in the way with production. Really look carefully at vitamin D in your textbook. This is a common vitamin deficiency, and here's a nice case study for you. You can always follow these as well. I'd recommend all of this. Vitamin E is another antioxidant. We find it in a lot of the fresh, very healthy oils. Keep in mind that it is destroyed by heat processing, however, so fried food is not a good source of vitamin E. It's an antioxidant, so it's a protector. And very high doses can thin the blood. So in someone who is taking a blood thinner already, taking vitamin E on top of that can enhance or increase the effect and possibly cause bleeding. That's something that you need to remember for your patients and for yourselves. Supplements and vitamins are not always safe. You really need to be wise and researched before you use them. Finally, Vitamin K. Vitamin K is the clotting vitamin, so it has the opposite effect of vitamin E. We make a bit in our intestine, and deficiency is pretty rare, but there's a greater risk of deficiency, by the way, if someone has a long course of antibiotics because it destroys the healthy microbes that produce vitamin K. Blood clotting. Toxicity is rare, but high doses of vitamin K can block the effect of blood thinners, and that's a problem as well. People who are sent home on blood thinners are told to keep consistent their vitamin K intake. Please read this case study, really interesting and important for future nurses. There you see the effect on blood clotting, another case study, and good sources. Now, I do want to mention these are some of the healthiest foods in the world, these cruciferous vegetables and dark greens. If you're not taking a blood thinner, you're safe and good to go on vitamin K. Vitamin K for healthy people has been shown to reduce the risk of all-cause mortality. So, very lastly, our last slide for this lecture is in regards to fat-soluble vitamin supplements. And as I mentioned, you really need to be careful, especially if you're working with a patient with some health conditions or taking medications. Always research things before you take them. And later on in our next mini lecture, I think we'll look at that. Okay, so we are going to end here. I wanted to